Good morning, I'm Amy Lynn. Surgery is often a gateway to persistent opioid use, with millennial women at the greatest risk of becoming persistent opioid users. Despite the availability of non-opioid pain management options, new research shows that opioids continue to be overprescribed following some surgeries, often leading to misuse and abuse. And joining us with more is Dr. Paul Sethi and Fred Munch, who is president and CEO of the Partnership for Drug-Free Kids. Good morning to both of you guys.
Hi, Amy.
Good morning.
It's just such a crazy problem with kids that it's so scary, but it does start a lot with surgery. And doctor, why do you think that is the case?
Well, Amy, I think there's a lot of reasons. Look, we have young kids who are getting ligament injuries and bad fractures that need surgery to repair them. And surgery hurts, and pain is very anxiety-provoking. In medical school and in residency training, we're taught to use anything we can to take care of our patients at all costs. We believed, incorrectly, that the appropriate use of opiate medication after surgery would not be addictive. Of course, in hindsight, we realized that we have to change because this was not the fact. Now, as we look at this, we want to look at methods where we can reduce the opiates, in fact, change the idea that opiates are our first line of pain relief, and rather they're a third or fourth line of pain relief.
A lot of the problem also is that so many pills are being prescribed after surgery.
And our study showed a couple of interesting findings. The first thing it showed is that still patients are getting more than 90 pills for rotator cuff surgery or more than 100 pills for joint replacement when we look at national averages. This is far too many and reflects a reliance on opiate medications. The other thing that's really startling is that 9% of patients were on medications longer than 3 months after surgery. This is really defining a dependence or an addiction to it.
Fred, what are you doing to help out with the Partnership for Drug-Free Kids with the opioid crisis right now?
The partnership is focused on empowering and supporting families and caregivers as first responders to help prevent substance misuse and intervene when the problem exists. And one of the things, we look at this in three ways. The first is to make sure parents and caregivers who are often the advocates in the family understand that there are other options aside from opioids when it comes to pain management.
So where can we go? What's the website to find out more information?
I think the website where we can find information is the planagainstpain.website, and this puts together all the information that patients need to know as they enter into a surgical procedure.
Thank you to you both. You can find out more about this segment by logging onto our website, fox4morningblend.com.